This training video is going to cover the suite of tools that are available for you on the Copeland quoting tool. So when you sign into the quoting tool, you will see the available products that you are able to quote. There's Medicare Supplement, Medicare Advantage, PDP, Final Expense, Hospital Indemnity, and Dental. So you can run a quote for any of those products to see a list of carrier rates and plan details. You also have access to a document locker and electronic scope of appointment. This allows you to capture those scopes electronically and store everything within that document locker. And then finally, we have the e-application. So when you are taking a quote for a variety of different products, you'll be able to submit an application right on the quoting tool instead of having to go and log into the carrier's website. So we're going to really break this training up into a couple of different sections here. One, we're going to go over the quoting, and then we'll go into the e-applications as well as the electronic scope of appointment. So to start, you can run a quote. So if I'm going to start here with a Medicare supplement, I can click on Run Quote. It will take you to the next page where you will enter in all of the demographics for the individual. So you can start by entering a zip code. And then over on the right, it will populate the city, the state, as well as the county. You can adjust your age, your gender, your tobacco status, and your plan type. So you can see here, because of the different MACRA eligibility rules changes, we do provide disclaimers if you quoted something. So I'm going to change that over to a Plan G. You will notice that error message does go away. You can adjust the effective date as well, so we do receive all the rates directly from the carriers. A lot of those carriers will send us rates ahead of time, so if you wanted to move that effective date out, you can certainly do so to see any new rates that may have came in. And then you can choose to apply a household discount or not apply a household discount. So this is the basic quoting. If you wanted to do some advanced quoting, so we do have this Show Advanced tab here at the bottom. You can click on that and you can enter in any health conditions or medications that an individual is taking. So for example, if they have diabetes, I can select the type of diabetes they have, the event occurrence, and I will go ahead and add that to my health entries filter. You can do the same with the medications. What this is doing, it's running these health conditions and these medications against the carrier's knockout health conditions and knockout medications. So when you do filter your results, it will only display carriers that may accept that client. We are not guaranteeing that they're going to pass underwriting, but it is at least looking at those knockout health conditions and those knockout medications. This section is optional, so you do not have to enter in anything there. If you just want to run a normal quote, you can certainly do so, and then you'll hit Get Quote. From here, it is going to show you a full list of carriers, a lot of information to be displayed on the carriers. You'll see the rate, if there's a household discount, a policy fee. You'll be able to see the company's name, their AM Best rating, how many years this particular subsidiary has been in the market, and then the effective date of the rates that are shown. Not necessarily the effective date of that block of business, but just the effective date of those rates. A couple other things that we have here, if you wanted to look at the plan details, see what is available with a Plan G for their Part A and Part B, you can see those different out of pockets. If you needed a copy of a PDF application, we have that as well, as far as a carrier resource button. So if you do need to go directly to the carrier site, we will have that. And then any carriers that are available on the e-application platform, you will see this Apply Now button where it will take you right into the application. And I will get to that here later on in the video. Still going through the capability of the quoting tool. So over here on your left, there's different ways in which you can view this information. I have my expand quote so I can see all of the different household discounts, policy fees, but if I would just leave that unselected, I can just see an entire list of carriers. If I wanted to apply any discounts, I would make sure that is selected. This would be making sure that that household discount is applied. So if you are running a quote on that first page and you selected household discount, this will automatically be check marked for you, but you can always uncheck mark it to change those rates. You can view it as a monthly rate or as an annual rate. We have some great market analytics available for you as well. So if it is an attain age policy, it will show you those age increases. These age increases would reflect if no rate adjustments take affect, what their monthly rate would be and what that percentage as they age increases. If this particular carrier took any rate adjustments on this current block of business, we will show that percentage and the date in the increase history. And then over on the right, we have the market data. So each year companies do have to report their lives covered, their premiums, their loss ratios, and percent of market share. So those are calculated every single year, so they will update as well. As I go through here, if you see any NAs or anything that shows 0, the NAs just mean that they have not taken a rate increase yet. Maybe this is a newer block of business, so they have not had one, or since it is a newer block of business, they have not yet have to report anything to any of their block of business. So some good examples here on how those are displayed. Over here, you can also view any select plans. So if you did want to see any select plans, you can do that. The underwriting filters, this would be if on that first page, if I did select the underwriting filters, if I wanted to go back and view those conditions, turn that off and on, I could do so. We also have the application health questions. So this underwriting tool is going to allow you to look at the look back period on the application. So I can use this search feature, and if I just have any heart conditions selected here, it will then tell me what it is on the application. So in this case, it's not on this application. It doesn't ask any questions on that. Sometimes it will show you the look back period. So whether that's 5 years, 2 years, etc., it would all be shown here on that look back period. You can unselect that here, and then it is removed here. So you can also filter it if you wanted to just show any plans that have a household discount or any plans without a policy. You can include those filters in your quoting as well. So a couple different ways to take this data and export it. We do have a print option, so it will just print this page for you, or you can export the quote results page into a PDF. We also have an Excel file where you can export all of the raw rate information. Really beneficial for you if you were creating any tables on your own. So a couple different comparison features that are available for you as well. We have 2 compare features. One is a compare quotes. The second is a universal compare quotes. So the compare quotes, if I select on any of these companies, it will go ahead and turn them green. They then show in my compare quotes box. So if I am comparing 2 Medicare supplements side by side, I can use the compare quotes. If I want to compare a Medicare supplement and maybe also add a dental plan, that's when I would use the universal compare quote. So I can compare multiple products, and then the compare quotes is just 2 products. So for demo purposes, I'm just going to do the compare quotes feature. When I click on the compare quotes, it's then going to take me to a page where I can see these 2 plans side by side. This would allow me to print off a PDF for a client, or maybe just save it for my records. So you can see those 2 plans are there side by side. And then up here at the in the upper right hand corner, you can export that to a PDF as well. And you can always use this back button here to go back to the quote results page. At the top here, it's a really good tool and be able to quickly change your quote. So if you did want to run a husband and a wife, for example, you can put in the the wife's information first, save it in your compare quotes, and then maybe you want to go ahead and run the same for a male. You can adjust that to male and then hit get quote. It will then bring up all of the male rates, and you can see here in your compare quotes box that your female rate is going to stay in there. And then I can select the male rate. So now I have the husband and the wife's policy side by side. So pretty easy to use there, being able to compare, add several different products to that. So I am going to remove both of these, and now I'm going to put one of this male's rate in my universal compare, because I'm going to show you how you can use the universal compare across multiple product lines. So over here on the right here, I have a universal compare. It's a globe. I'm going to click on that globe. It will then turn my bar purple, and then you will notice here it goes into my universal compare quotes. So from here, there's a couple different ways in which you can navigate through the quoting tool. One, you can just go up here and select Medicare Supplement and go back to your dashboard. Or what you can do is go into a different quote. So for here, we're going to go to Medicare Advantage. So we'll start by entering the zip code. Again, it will populate the city, the state, as well as the county over here. So again, it works the same as the Medicare supplement works. So no matter what product you're quoting, it's going to be running the quote and then selecting those details and the demographics. So under plan options, you have the Medicare Advantage, Medicare Part D, or special needs plans. So we can go ahead and start with the Medicare Advantage. You can also filter by the plan type as well. So if you did want to select an HMO or a PPO type plan, you can filter that way as well. And then go ahead and hit get quote. And this is going to populate all the different Medicare Advantage plans. So you are going to see them listed out by price. And since the Medicare Advantage plans are $0 a month premium, we will then sort by the max out of pocket. So that's how you can tell the different sorting feature on the Medicare Advantage. Again, several different details about that particular company. We have the star ratings, the drug deductibles, what type of drug benefit it is, the plan type. We also have all of the plan names as well as the plan IDs. So you can always search for one by looking at those plan IDs. We do have within the plan details section, this is going to show you a complete list of all of the different benefits that are available, what those copays, those out-of-pockets, what is all covered, as well as the different drug tiers. We do have a show all plan details feature here as well, so if you wanted to see an entire list of all of the plan details, just make sure that that is selected there at the top. If I go back here, I'm going to go back to my quote results page where I can see all of the different available plans. We do have different carrier resource links, so these are links that will take you directly to that carrier's website, kind of a quick, easy way to navigate there. We also have the carrier resource button here, so this will take you directly to look up the physician lookup, the formulary websites, the pharmacy website, so you can check to see if that individual's drugs or pharmacy doctors are included within that plan. So we do have those links available for you as well. Again, there's several different ways in which you can view this information. You can have your quotes expanded. You can view it as an annual rate instead of monthly. And then we also have these market analytics. These can be extremely helpful when you are trying to figure out the penetration and also to see what the popularity of a certain plan is. So we have the county penetration. What that means is out of everyone who is eligible for a Medicare Advantage plan in this county, it will show you the number of eligibles, and then how many are actually enrolled in an MA plan, and then what that penetration number is. Out of those roughly 30,000 individuals enrolled in an MA plan in this county, how many are actually enrolled in an Aetna MA plan? So it will tell you that number as well as the penetration there. We do update this every single month, so you can see those numbers come in there. That will update for you automatically. You can notice here I still have that Med Sup Universal in that Universal Compare Quotes box. So I still have that available, and I can do the same different types of comparisons. If I wanted to compare two MA plans, those show up my compare quotes. But let's say in this case I want to show them the difference between an MA plan and a Medicare supplement plan. I can go ahead and use that Universal Compare Quote box. Universal compare here, and I can have those two plans side by side. So very helpful tool for you to do that. You can uncheck mark that. And again, this is really easy if you want to start filtering here. So I have the results. Maybe the results can be overwhelming. If I know I want to put them in an HMO plan, I can select that and then hit get quote. So a lot of filtering that you can still do on this page as well. You have all of those different export options, the PDF, the Excel file. So really, no matter what product you're quoting, the process is going to be the same. The look and feel is going to be the same. So very easy tool there to go ahead and use. Now I'm just going to quickly kind of cover the other products fairly quickly here. The Final Expense Life, another tool. It basically just starts by entering the zip code, then the age, the gender, the tobacco status. You can put different face values in here, so it's going to automatically default to 10,000, but you can adjust that face value. Maybe your client only has a certain amount that they can allocate to a final expense plan. You can also run a quote by a monthly rate as well. So if I put 50 in here, it's going to populate any plans that are $50 or less for me. I can also check it by product type, whether that's graded, level, 20 or 30 pay, modified, return a premium. You have those options there. And then we have the underwriting. So whether it's a full underwritten, so this would be any full or simplified issue. So any type of plan that would require any type of underwriting would be considered full, or you can do a guarantee issue plan. And then from there, you would just hit get quote. You can see those different plans available. So kind of different information that you can view on the final expense. One, it is going to tell you that annual fee. We'll have the AM Best ratings, the S&P ratings if they are available, the number of years in the market, any of the parent company names. Over on the left side, you can adjust your views. So if you wanted to apply any of those annual fees to the quote, you can make sure that's applied. You can also view it as a monthly, quarterly, semi-annual, or annual rate. So you have those different adjust view features. Similar to what we had on the Med Sup, we do have the application health questions. So again, if you do type in a certain health condition, it will tell you the look back period on that application. Look back period is 1 year for the criteria that it has been entered. We also have the carrier resource button for several different carriers on here. This again would take you directly into the quoting tool. Plan details is just going to have a brief summary of those plan details, how it breaks out with those different payments, and the different company details there. All right, next I'm going to go into the dental. So again, same way, starting with the zip code, the age, the gender, the tobacco status. Then we'll hit get quote. It is going to bring you a complete list of all of the different plans. It is going to be priced out or sorting by price, so you will see some of these vision plans come in first, but then you will see the different type of base plans, the deductibles, the policy year maximum benefit. So those are different information that's going to be labeled in the dental. If you do go into the plan details section, we will have a complete list of the details of that particular plan. So if what is kind of covered underneath that plan, this one wasn't the best example here, so I'm going to go back here and give you a better example. We'll go into the Medico's plan details section. You'll see what is covered as far as the policy year deductibles, what's covered for cleanings, non-surgical, everything that you need to know. And if it did include vision or hearing, those benefits would be included in there as well. So a lot of times if they are doing a Medicare supplement along with a dental plan, again, I do have my universal compare quotes box in there. So if I wanted to throw in a particular dental plan, I can just put that into my universal compare. Now I can do a side by side with a med sup and a dental plan there. Really good for cross-selling. Definitely a good feature to have there for you. Last but not least for the quoting, we are going to get into the hospital indemnity. Hospital indemnity goes great with a Medicare Advantage plan. We do have a fill in the gaps tool, so it allows you to do a Medicare Advantage as well as a hospital indemnity side by side. So I'm going to show you how to do that as well. It's a really great tool to have to be able to really assist with that cross-selling. So again, I'm going to run my normal zip codes. I'm going to see all of the plans that are available, the household discounts, the policy fees. If I want to go in and view any of the plan details, again, we have those plan details so you can see the complete list, what's included, any of the riders. So a lot of these hospital indemnity plans, we can adjust that benefit amount. So I can change that there. I can add any other riders, and then it's going to tell me how my premium changed. So if I do want to make those adjustments, I can see what that does to that base rate. It will have all of those added add-ons that are optional if I wanted to do a more accurate quote for the individual. So that is a good feature, but I'm now going to show you what we can do with the hospital indemnity and the Medicare Advantage. So what I'm going to do again is I'm going to go run a Medicare Advantage quote. And I'm just going to select any of the Medicare Advantage plans. I'll go ahead and hit on the plan details section. Now I have this fill in the gaps tool, so you'll see it here in red. When I click on fill in the gaps, it's going to automatically carry over that zip code, the age, the gender, and the tobacco status will default, but then you can change that, but it will carry over that zip code. From there, I'm going to hit run quote. Then it's going to bring me a drop down of the different hospital indemnity plans that I can choose from. So maybe I am familiar with a particular company's hospital indemnity plan. I'm going to select that plan. I'm going to add that to the comparison. So now I can do a side-by-side comparison of my Medicare Advantage plan next to my hospital indemnity plan, and I can see how I can add those different riders. So I can really visually show my client they have some coverage gaps in their Medicare Advantage plan, and this hospital indemnity plan is going to cover those coverage gaps. So if I have a copay for my ambulance, if I wanted to add that rider, it's just going to say it's an extra $3 a month to cover that copay. Do you want to do that? Again, you can do any of these, so it's going to really show you that side-by-side comparison there. Make it pretty easy for you to do any of those different cross-selling features. And now we're going to go into the e-application platform. So I'm going to show you how to do an e-application right on this platform. For this training, I am just going to do a Medicare supplement plan. Again, I would start by just running a quote. I kind of showed you this in the initial part, so we'll go ahead and we will run a quote. In your quote results page, any carriers that are available for the e-application, you will see this apply now button. So when you click on apply now, the first step is going to validate you are appointed with that particular carrier. The first time you try to submit an application for the carrier, you will have to enter in your writing number or your so each time that you enter, we are validating that you are appointed with that carrier. Application here, you will see your writing number and your producer number automatically carried over, as well as that quote that you initially ran. So there's a couple delegation bars at the top. You can collapse those, that way you have a little bit more room to see on your screen. As I mentioned, your quote information carries over here on the right. Any initial documents as far as the application and outline of coverage, the terms, everything is available. So if you needed a paper version of the application, you can open those, download them. You can also send any of these documents as well by selecting email address and then typing in the email and clicking send documents. So when you are going through the application, it's first going to ask you to select your underwriting type. So depending on the situation, certain sections will appear for you to go through each of the sections. So if you were doing a fully written application, you will have those health questions and medication section. Date of birth. And then it is going to ask us for our eligibility. So what this application is going to do is based upon your underwriting type, based upon your client's date of birth, their Medicare Part A and Part B effective dates, it will make sure that the type of application, underwriting type that you are submitting is accurate. It's also going to make sure that any of the new macro rules are taken into consideration here too. So if I was trying to submit an application for a plan type that the individual is not eligible for, it will notify me of that and make sure that I change that before submitting the application. Really what this application is meant to do is make sure that your applications are all submitted in good working order. So it is validating as you go through each of the sections of the application. What's also unique about this platform is that whether you are submitting a application for Aetna or Mutual or any other carrier that is on this platform, it is going to be the same process, the same look and feel. So there's only one application that you have to learn and understand how to work. So with this, I will just start by going through each of the sections on the application. So I'll just go through and complete each of these sections. You can navigate through the application. So if you needed to start by doing their application information, if you for some reason have to skip to the method of payment or ever come back to certain sections, you can skip through the sections. When the section is complete, you will see this green check mark just letting you know that section is complete. All the information has been validated. If you see a yellow icon, that means there's either incorrect information, it doesn't match what you are entering, or there are parts of that section that you still need to go in and complete. Once each of these sections have been completed, that's when you can go ahead and review and lock the application. So we're just going to quickly go through the steps here of submitting the application. You can see that you can change your plan type, you can change your effective date versus the original that you quoted here at the top. So this app, you can work through it. You can see that I am not eligible for a Plan F because of my Medicare Part A and Part B effective dates. You can change this application, so if they wanted to change from a G to an N, anything that you do will automatically update the quote details. So if you originally quoted a non-tobacco and they answer yes to the tobacco question, it will change that rate for you. So it is a smart application. It's going to go through and validate everything that you are typing. So we're going to start by just starting to fill out the applicant's information, first, last name, their address, home phone number, age, date of birth. So if you enter an incorrect age and the date of birth does not match, it will update this the quote. If it is an application that is based upon the height and weight, if there are requirements for that, it will notify you. What also it's going to do here as kind of talk through this as I'm filling out the application, you as you are going through this sections, especially the health questions, the medications, if you answer yes to a health question, that is going to be a knockout health question, or if you enter a knockout medication, the system is going to notify you of that. So over at the top here, you have your overview, you have your notifications. So if you did enter something that is incorrect as far as your underwriting type goes, or you submit a health condition that is a decline, it will notify you of that and make sure that you are aware, just so your application is submitted in good working order. Here's a section for household premium discount. So if there was a household discount, it will ask you to fill out that information. In this example, we're going to say no, there's no household discount. We'll go ahead and hit continue. Enter in the social security number. And then again, it carries over the Part A and Part B effective dates there. This next section is just going through the previous or existing coverage. You can notice here that the application is really easy to walk through, just completing the sections, hit continue, so it automatically jumps to the different sections here. And you can see here, as I'm going through here pretty quickly, I'm already getting a green go for all of these sections. So there are some different signature options here, but you do have the options to print for a wet signature, so that is an option that you can do. In this case, we're not. We're going to do the applicant is present, and we'll go ahead and do an e-sign. And then you will type in the routing, the bank information. You can either search by the routing number, or you can type in the bank name, and it will automatically populate there for us. Now we are not validating the banking information, so the banking information is still going to go through with the application to the carrier to validate. So if for some reason you did enter an incorrect routing number or account number, the carrier will notify you of that. So we can pick when we want to withdraw from the bank account. I can select a previous day. In this example, we'll just do the last day of the month. And hit continue. The to be completed by producer section, this is where you can add any notes to the underwriter. So if you were going through this application and you answered yes to a particular health condition, or you wanted to explain a medication that they were taking, or if you needed to upload any supporting documents, the to be completed by producer section is where you are going to go through all of that. So we're going to deliver the policy to the applicant. Verify that everything you are entering is correct. Again, I don't need to add any notes here. This is an open enrollment situation. I'll go ahead and hit verify application. So when you hit verify application, it's just going to make sure that all of your sections have been completed. It's going to give you a nice summary of all of this section, so you can go through and just review everything. So that's what we're going to review here. I can just make sure all of the applicant information is accurate. If for some reason I did see an error, I can go back in and edit that section. So don't worry about that. You can still go back in and make any corrections. But once you have locked an e-sign, you will not be able to go back into the application. The applicant would have to give consent to go back in. So again, another option, if you wanted to print for a wet signature, you have that option. We are going to lock an e-sign now. This will be the applicant agreeing to the terms and the conditions of the electronic signature. Go ahead, I agree, and continue. So there's two ways that you can do a statement of signature. So if you are in the same physical location as the client, the applicant can provide identification information. This would be their mother's maiden name or the last four digits of their social security number. If the applicant is not present, you do have that email signature link, so it would send the individual an email for them to complete their portion of the application, that signature portion. In this case, we're going to say the applicant is present and they're going to provide identification information. You will have to open up each of these sections of the application and review them for accuracy. This is also your option to print any of these forms. So you do have a copy of that, especially the application. It's important for you to make sure that that is all in your records. I will go back to the application here so you can see that the application is filled out on the actual carrier's paper. Important to note that. So then you have, can check mark this, I have received, read, and kept a copy of the above documents. This would be the applicant signing it, so their mother's maiden name, and then the last four digits of their social. Acknowledging where they are signing, the city, the state, and the zip, and then they'll hit apply e-signature. It will then be the producer's turn to sign. It will automatically carry over your producer name as well as your producer number, and then you would go ahead and apply that e-signature and then sign application. So once that application has been signed, it's going to again validate all the information. What it's going to do when it is done is it's going to pop out a policy number for you. So it will, as you can see here, it's preparing that application. I'm in a testing environment currently, so it's not going to pop out an actually policy number, but this is where it will, so you can write that down for your records. It also gives you an opportunity to review the documents once again before you close out of the application. Then all of this is being submitted to the carrier. The carrier will review it and issue the policy. So if you hit return to applications, all of your applications are going to be stored in your applications panel that is accessible through your dashboard when you sign into the quoting tool. So you can see here that it is always going to give you a summary of the application, the applicant's name, what is the status of that application, the date you created it and last modified it. Any applications that have been completed will say completed, and it will be green, and it will show you a policy number there. You can always go back in and edit an application, so if you did start and you have to resume it at a later time or a later date, you can go back in and edit that application, or you can always discard any of those here. So when you do have a lot of applications in here, we do store the applications up to 60 to 90 days, depending on the carrier, but all of the applications will also store on that carrier's agency portal, so you can see all that information that way as well. If I needed to get back to the quoting tool, you can just hit these navigations bar and you can go back into running a quote for a different product. Now we're going to go over the document locker and the electronic scope of appointment. So those are two new features that you will see here. Again, the document locker, this is where all of your electronic scope of appointments will save. So after you complete them, you can always store them in your document locker. We'll go over that here in a second. And then the scope is where if you wanted to start a new scope, you would just click on View List here. Any documents that you have previously started, so for some reason you got in it, you were waiting to complete it, or you were waiting for an email signature link, all of those will store on your resumed incompletes here. But then if I wanted to go ahead and start a new one, I would go ahead and start document. I can always download a copy of the generic scope, or I can preview one to see what it looks like. For this, we're going to go ahead and just start the document. You're going to give it a title. And then hit save and continue. From there, we are just going to agree to the terms and the conditions of the electronic signature. So we'll scroll to the bottom here and hit I agree, and then hit continue. There's two ways in which you can capture this signature. One is if you are in the same physical location as the client, you can do the applicant providing identification information, which is going to be their mother's maiden name and the last 4 digits of their social security number, or you can do an email signature link. This will send the applicant an email with a verification code. They'll click on the link in the email and then enter in their verification code, and then they will complete the steps and fill out which sections they want to discuss with you and then sign it that way. In this demo, we're just going to do the applicant is going to provide identification information. We'll hit continue. Here they will just select which products they want to discuss. So in this case, we're just going to do a Part D plan. Then they will type in their name and then enter their mother's maiden name and the last 4 digits of their social, and then just verify where they are signing it. Then hit apply e-signature and hit sign and continue. From there, it will take them to the agent confirmation page where the agent will type in their name, enter the phone number, and then type in the beneficiary's information. And then their address. Date the appointment was completed, and then we'll hit continue. And then it will carry over the agent or the producer's name over to this next page, and then you'll just select apply signature, and then you're going to go ahead and sign it. So it's really quick, really easy to do. You can then save it to your library, so this would allow you to save it to your document locker, which I'll show you here in a second. And then from here we can preview that document to see what it looks like. So I can see that I have the individual's initials here, and then the signature is an electronic timestamp. So you are protecting all of their mother's maiden name, the last 4 digits of their social. You are protecting that because it comes over as a timestamp. So you are safe there. From here, we'll go ahead and hit Save to Library. So when I save it to my library, that will give me an opportunity to save it and to download it, to preview it as I need to. So this is what your document locker looks like. From the very start, you could create an electronic scope from your document locker. You can upload any other supporting files. So let's say when we were on that quote comparison page and I had those 2 plans side by side, maybe I wanted to save that quote into a PDF, and then I wanted to upload it. So think of this as kind of a CRM system where you can create different folders for your clients. You can upload their scope, you could upload an application, you can upload a quote that you ran for them, so you can go back to those. You can create the folders, you can create subfolders, or you can just have the documents saved, and then always you can download them or you can preview them to see what they look like. Keep in mind, everything is going to be secure on here. So this is a secure platform, a safe environment for you to store these different scopes. We will store them. So if you do need to come back 9 years down the road and you need to get a copy of it, we will still have all of these, so you can know that you are protected in that sense. You also have the ability to export this at any time. We are never going to keep information from you, so anything you upload into this, you can always export it at any time. We do have the search feature as well, so that works great. So if you do end up having a lot of different folders, a lot of scopes, you can always search for a client's name, and it would bring up any supporting documents. So very, very easy to use here. That the document locker. Again, you can always access it from your dashboard page or after you complete that scope of appointment. The Market Edge heat mapping does a couple of different things. The first, it's going to track the Medicare demographics. So it's going to let you know in a certain area how many Medicare supplement versus Medicare Advantage enrollments there are. It's also going to show you the quoting activity that happens within the CSG quoting tool. So there's a lot of agents across the nation who use our software. So it's going to gather all of their activity as well. So you can see the activity of other agents in your area. So when you click on the Market Edge, you can start by selecting a state. In this example, we're going to go ahead and do Texas. You can also do it by zip code as well, so a 3-digit zip or a 5-digit zip. Once I run Texas, I will be able to drill down a little bit further there. And then the quote parameters, this is going to be if you did want to see the quoting activity. Maybe you want to know how many agents in your area are quoting a Plan G. You could type those different quote parameters in here. You can just leave the all ages selected, gender, but unless you wanted to drill down to see that, you could do that. So we're going to just do a G for an example. And then you can change the quote range. So this would be, it's going to default to the last 30 days, but if you wanted to extend that out, maybe you want to look at everything from last year or within the last 6 months, you can adjust the time frame there. And then you can view this information a couple of different ways. One, you can view it on a map, a chart, or a table view. I recommend starting with the map view. It really gives you a good example and allows you to drill down into the different zip codes. So we'll just hit run search. So now it populated what we call a heat map. Over on the left hand side, you are going to see those different zip codes and then the med sub quotes. We do have the ability here to zoom in a little bit further. So as I hover over these different areas, you are going to see what that quoting activity is. It says 0 for Med Advantage quotes. That's because I'm only looking at a Med Sup Plan G. So I know within the last 30 days, 280 Plan G quotes were ran for this 3-digit zip code. I can also look at the population over age 65, turning age 65, and then the Med Sup and Medicare Advantage enrollments numbers. So this is really going to help you figure out pockets of opportunity where you should have your focus on. Let's say you do sell more Medicare Advantage than Med Sup. You are going to want to use this tool to find those pockets that have more Medicare Advantage enrollments than Med Sup enrollments, just because of how that population, that the demographics, that is what is more popular in that area. So you can see how these numbers change as I hover over those different areas. Now let's say I did want to drill down a little bit further into a zip code. So I'm in this area. I'm going to zoom in. Now I'm going to look at a 5-digit zip code here. So now I can see at a 5-digit zip code level the number of quotes, that median household income, and then the population over age 65 and turning age 65, and then the Med Sup and Medicare Advantage enrollments. So you can kind of view all of those different details. You can run national maps, you can run it by state like I did, and then if you wanted to look at this information in a different view, you can go ahead and change that display type over here on the left to either a chart or a table, and you can look at it that way. The second feature that this tool can do for you is mapping a carrier's competitiveness. So when we do that, we do want to go into the rate comparison tool here at the top. So you'll still go into Market Edge, but then when you get to the Market Edge, make sure you click on that Go to Rate Comparison. This is where you're going to heat map a carrier's competitiveness. And you can select a carrier, you can compare it against different carriers, or you can compare it against all the carriers in the market. So in this example, we're going to just go ahead and do an entire US map. So you can kind of see how this map all maps out. You can always just do a single state if you wanted to. You can change your effective date, so maybe you do know that there are future effective dates coming into place. You want to see how that new carrier is going to change the landscape of the market. And then we do have to put in our map parameter. So we do have to enter in a plan type, tobacco, gender, etc. So in this case, I'm going to look at a plan G. I am going to have a non-tobacco. We're going to go for a female, and maybe we're just going to look at age 68 for an example. I'm going to make sure that the rates, we are applying that household discount. If I wanted to include those demographics on the previous map, I can include those here. Or if I wanted to compare them against select plans, I could do so as well. I'm going to leave those not included for now. And then the primary company, for the different companies that do have multiple subsidiaries, for example, Aetna, you can select all of the subsidiaries so it does map every single one out for you. Just make sure that you do take a look at some of these rating classes just to make sure that you are having all the default rating classes on there. You could just do a single company as well if you just wanted to do one. And then under the compare companies, this is where you can select the companies that you want to compare Aetna's subsidiaries to. So maybe you want to take Mutual, Cigna, a couple of other carriers. You can select just those, or you can compare them to every single carrier in the market space. So this is going to include every carrier, all the direct-to-consumer plans that we have in the quoting tool as well. So you really get an accurate picture on where they are actually competitive and having the lowest rate. Then we can do our comparison values. So it is going to create a heat map, and I'm going to use these different dollar ranges to kind of customize that heat map. So this is the default 5 and 10. I'll show you here how that looks on the next page. So if you did want to adjust those, you certainly can when you are running this map. You can see in the background it is generating that map for us, so you do know that it is working. Sometimes it does take a couple seconds here to generate that entire map since it's bringing in all of that rate data for us. You can kind of already see the colors as it comes through, so we're going to kind of talk about that. The color, the green, that means it's the lowest premium in the area. Within $5 of the lowest plan is going to be yellow, so that's where that $5 comes into place. And then a premium between $5 and $10 of the lowest rate, over $10, and then the gray means that there's no rates in that area. So as I hover over these different 3-digit zip codes, I can see the premium difference. So in this particular Kansas zip code, that means that the Aetna's plan there is $5.30 away from the lowest rate. So this is interactive, so you can go and search. This is really helpful instead of having to run several different zip codes. This really just helps you see a big picture of where they're competitive. And then again, this is just for a certain plan, gender, age, tobacco status, etc. So you can play around with those different quote parameters for you, and then go ahead and save your searches. So if I save my search, that means I can just go back each month and I can run a new map. Maybe there are new carriers that are coming into the market space, and I want to see how those new carriers affected this main company that I'm looking at. You can save those searches so they're easily to run, and then you can always export these into a graphic, so you can print those off and save them. The other Market Edge tool where we did the different demographics, that is all information that you can export as well. You have the capability of exporting that into an Excel file for all that raw rate information as well. So that's how the mapping tools work. Again, there's those different features that allows you to do. This rate comparison tool, this is a newer tool, so it is really helpful in being able to map those different companies. So I'm just going to go back here and show you the dashboard one more time. Again, you have all the products that are available to you. You have the Market Edge, which I just covered, all of the quoting products, the document locker and electronic scope of appointment, and then the e-application. So if you ever have any questions on how to use the quoting tool, or have any questions about a rate that you're running, we do have a support contact option for you. So if you did want to send a message into us, maybe need some clarification on something or need some assistance on running a quote or running a map, feel free to use that contact support, and we're always happy to help you.